I would like to invite the next speaker, Dr. Sneha Bhopatkar. She'll be speaking to us on anterior segment optical coherence tomography, a quantitative method of scleritis evaluation. I think that'll be a really interesting talk. Looking forward to it.
I hope my slides are visible.
Yes.
Good morning, everyone. I'm Dr. Sneha Bhopatkar, and I'll be presenting a paper on AIOC as a novel method of quantitative evaluation in scleritis. And Dr. JB sir is my co-author. I have no financial disclosures. Scleritis is a clinical diagnosis where patients are generally presenting with redness and pain, especially increasing on ocular movements. Few reports of evaluation of the scleritis using UBM are available, but still there is no definitive mean of quantitative evaluation. As AIOC is a good tool for assessment of cornea, anterior chamber, and sclera, our study aimed at evaluating characteristic findings on AIOC, which could help in diagnosis and management of the scleritis. Our study is a retrospective analysis of 42 eyes of 36 patients who came to our tertiary eye care institute. 24 eyes had followed up until the scleritis became inactive, and the AIOC was done post-treatment during the inactive stage. The rest of the eyes, that is 22, which could not be followed up until inactive stage, the normal other eye was used as a control. All the AIOCs were recorded using Zeiss Visante, and the scleral thickness was measured in all the quadrants, and it was compared with the same quadrant of the control group. The area of the focus of our study was the scleral thickness and presence of hyporeflective spaces on the AIOC. 64% of our cases were of diffuse scleritis, and the rest included nodular, necrotizing scleritis, sclerouveitis, and sclerokeratitis. 45% of the active cases showed the presence of hyporeflective areas, which could consider only, and if you consider only diffuse scleritis, about 92% showed the resolution of these areas post-treatment. When we compared the quadrant with the maximum scleral thickness with the same quadrant of the control group, we found that there was significant difference between the scleral thickness of the cases and controls. And if we correlate with the diagnostic findings in the clinical picture, here is an example showing hyperemia in the superior quadrant of the sclera on slit lamp image, and the corresponding AIOC of the superior quadrant, which is showing increased scleral thickness with few hyperreflective spaces in here, most probably. The image below is showing the AIOC in the inactive stage of the same eye of the same quadrant post-treatment, and the decrease of the scleral thickness and hyperreflective areas were noted. Our findings were in consistency with the previous studies, which showed about 200 microns increase in the scleral thickness in active scleritis. And as per our understanding, the hyporeflective areas could be the pockets of either scleral edema or dilated vessels, and a significant reduction was noted in the inactive stage. And here I would like to conclude by saying that AIOC could be used as a tool to supplement clinical diagnosis using scleral thickness and hyporeflective areas as the factor of evaluation. Thank you. Thank you so much.